As a natural medicine practitioner for over 30 years, I have developed a variety of different intake forms that I use to get a lot of information from different new patients and follow-up patients so that I can do a comprehensive understanding of what's going on and advise them as best as possible on how to get 100% or as close to 100% functioning back as possible. I have various intake forms. They're like this packet, which has a health history questionnaire and a differential diagnosis questionnaire that helps me divide up what's going on in their body with respect to various systems. Now, I work very hard to communicate effectively with my patients so that I can understand what's going on with them and they can understand the whole process of getting better. In understanding them more effectively, I like to use the B.A.N.K card system. Now, originally, a couple years ago when we first started, this is the size of what the cards were. And so each patient, when they come in after they filled out the forms, we ask them to take a look at these cards and to put them in order of most important to least important. In that way, I also mark the code on the outside of the file so that when I am working with someone that I can look at it and I can be sure that I am addressing their concerns in the way that they like their information provided. It also, I use NLP as well, so that if they're visual, I like to bring out charts. If they're auditory, we rely on the spoken word more. Now we have these much smaller cards in the evolution of the B.A.N.K code system. They work very well as well. And I also then like to take the results of this, put it into the online Play B.A.N.K code process, and then send them the information as well about their code. It's an educational process. That way they can use it with their families as well. And I find I can use it in my personal life very effectively as well as in my professional life. So if you have any other questions, feel free to check out our website.